Good afternoon, Madam Chairman, ladies and gentlemen. My name is Sonia Lowen and I am the Chairman of Debating SA. We're appreciative that we have been given permission to conduct our grand finals here in this august chamber of Parliament. Debating provides a formal framework in which students learn to conduct themselves in a civil and courteous manner to each other, the adjudicator and their opposition, and to abide by the rules. The ability to master anything in life is a challenge. Debating presents a challenge to students. It challenges their research and reasoning skills, how to organise and formulate arguments, how to communicate more clearly, and how to examine and consider a case that might be, at times, in opposition to their own personal views. Debating builds character. It requires fortitude, diligence and motivation. In order to have made it to the grand finals, the debaters here today have had to be determined, self-disciplined, dedicated and hard-working, and I commend them for these attributes. Thank you.
Good afternoon, ladies and gentlemen. Welcome to the 2023 Year 9 Debating Essay Grand Final Debate. My name is Jessica Thornhill and I am the chairman of this debate. The timekeeper is Sylvie Jagged and the topic for this debate is that the ACT's decision to reduce penalties for the personal use of drugs is a good idea. The affirmative team sitting to my right is from Aberfoyle Park High School. The negative team seated to my left is from Westminster School. The grand final debate will be judged by a panel of 5 adjudicators, who are Charlotte Boyd-Turner, Ella Goulding, Jonathan Parsalidis, Liliana France, and Tony Huey. The speaking time for this debate is 5 minutes. A single warning bell will sound at 4 minutes, and a double bell will sound at 5 minutes. A continuous bell will ring 30 seconds after the final bell. Please switch off your mobile phones and other electronic devices. I declare this debate open and call upon the first affirmative speaker, Amina Anklis.
Good afternoon, Madam Chairman, ladies and gentlemen. The topic for today's debate is that the ACT's decision to reduce penalties for the personal use of drugs is a good idea. We define the abbreviation ACT as the Australian Capital Territory, a self-governing territory in Australia. We define the phrase decision to reduce penalties to mean the ACT Drugs of Dependence Personal Use Amendment Act 2022, effective as of the 31st of October, which exempts individuals from criminal liability for possessing small quantities of certain drugs. We define the phrase personal use of drugs as the use of drugs by an individual for their own consumption, not for supply or trafficking. We define a good idea as a proposal for a course of action that has positive outcomes or benefits using an in-depth process of analysis, consideration and discussion by all stakeholders in the outcome before enacting a decision. Therefore, we, the affirmative team, firmly believe the carefully considered decision by the ACT to reduce penalties for the personal use of drugs is definitively a good idea. Today, as first speaker, I will speak of social and scientific consensus that the use of drugs is a health issue and how the removal of imprisonment penalties will redirect scarce resources and relieve an unsustainable cost burden on government agencies and the justice system. Our second speaker will demonstrate how the reduction of penalties will improve individual health, relationships, and integration into the workforce. Finally, our third speaker will present rebuttals and summarise our team's case. For my first point, through extensive consultation and research, the ACT's decision, which removes a criminal penalty for a civil penalty of one penalty unit, $160, for personal possession of a defined limit of proscribed drugs, such as heroin, cocaine, meth, and MDMA, is a good idea, because it treats the personal use of drugs as a health issue, rather than a criminal one. According to ABC News, the ACT has become the first jurisdiction in Australia to adopt this policy, following a parliamentary inquiry which found that criminalising drug users does not deter drug use. Also, evidence from countries like Portugal, which decriminalised drug use in 2001, shows a significant decrease in drug-related deaths. The nature of drug addiction displays that criminal penalties will not stop a user's dependency on a drug. According to the National Institute of Health, substance use disorder is a treatable mental disorder that affects a person's brain and behaviour, leading to their inability to control their use of drugs. We must consider the impact that drugs have on people, which leads them to act irrationally and with desperation. Convincingly, a study done by Britannica on the prohibition of alcohol in America from 1920 to 1933 showed the adverse effects of criminalizing the use of a dependency-inducing drug, including a rise in organized crime, an increase in smuggling, a decline in tax revenue, and the ultimate formation of a black market. Ladies and gentlemen, through real-life examples, we can see how criminal penalties have failed to address this core issue of drugs. So, rather than repeating history, the ACT has put a real solution into action. Now to my second point, that the removal of imprisonment penalties will relieve some huge cost burdens on government agencies and the justice system. According to the United Nations Office on Drugs and Crime, drug trafficking constantly evolves, undermining economic and social development, and contributing to crime as well as instability and insecurity. According to ABC News, drug users push prisons to breaking point, with $107,000 allocated to keep each offender behind bars for a single year. Through reducing the penalties to no longer facing imprisonment, but rather to receiving a fine, according to the Alcohol and Drug Foundation, we will substantially reduce costs and time directed towards courts and prisons, police, health and rehabilitation, social welfare and programs, as well as remove many negative consequences of drug use. If both economic productivity and time are lost through imprisonment, why is it not a good idea to put limited resources towards a real solution? So, Madam Chairman, ladies and gentlemen, to conclude, we, the Affirmative team, firmly believe that the ACT's carefully considered and scientifically supported decision to reduce penalties for the personal use of drugs is a good idea. Thank you.
I call upon the first negative speaker, Jordan Lucas.
Good afternoon, Madam Chairman, ladies and gentlemen. The topic of our debate is that the ACT's decision to reduce penalties for the personal use of drugs is a good idea. We agree with the definition given by the Affirmative team, however, we wish to amend the definition of the terms decision and personal use of drugs. We define decision as resolution enshrined in law, and we define the personal use of drugs as a quantity of an illegal drug that is not intended to be supplied or trafficked for profit, but for individual recreational consumption. Before I present my arguments in detail, I will rebut the arguments of the first Affirmative speaker. The first speaker of the Affirmative team say that reducing penalties has worked in other countries. This is a red herring fallacy, as it is not a debate about other countries. It is a debate about the Australian Capital Territory, not other countries. Similarly, it is too risky to assume that a procedure in another country can be replicated in the ACT, a unique and different territory. Therefore, other countries are irrelevant to the current debate. This is also partly a faulty analogy, as it is not possible to compare other countries with a territory such as the ACT. Today, as first speaker, I'll be speaking about 2 points. Firstly, that the ACT's decision to reduce the penalties for the personal use of drugs is a bad idea, as there is no evidence to support that reducing penalties in the ACT will motivate drug users to refrain from using drugs for personal recreation, and that a federal legislation is a better idea for effectively reducing drug crime. Our second speaker will be debating that the ACT decision to reduce penalties for the personal use of drugs is a bad idea because this method has been proven to be unsuccessful in other places, and it is more important to take preventative measures rather than reducing penalties that lead to confusing messages for drug users. Our third speaker will rebut and sum up our team case. And now to my first point, that there is no evidence to support that reducing penalties in the ACT will motivate drug users to seek out health services. According to the ACT Government Health website, the purpose of the reform is to reduce stigma around drug use and ensure that drug users are offered health support services designed to keep them out of the justice system. The ACT's decriminalisation approach is flawed, as there is no concrete evidence to suggest that reducing penalties will motivate drug users to attend health services. As such, there is a missing step in the ACT's implementation of the amended law. The assumption that individuals will be more inclined to access health services because of reduced penalties is questionable. Chris Goff, Executive Director of the Canberra Alliance for Harm Minimalisation and Advocacy, suggests that the ACT's decision does not address systematic barriers that deter individuals from seeking help, such as the lack of affordable access to rehabilitation. Neither does it guarantee destigmatisation. Stigma is deeply ingrained in society and is unlikely to dissipate simply due to decreased penalties. In fact, it is more likely that this may inadvertently perpetuate stigma by failing to address its root causes. A study from the Ashley Treatment Centre reported that when drug users present for treatment, over 70% confessed that they were contemplating not attending treatment due to feelings of shame. There is no clear evidence that suggests this amendment will eradicate such feelings. Therefore, the ACT's decision is a bad idea. Now to my second point, that a federal law would be required for such an important reform to be effective. A unified approach to drug policy is crucial. If each state and territory have separate drug penalties, it may create significant confusion and legal challenges for individuals travelling between jurisdictions. The ACT is the smallest Australian territory, and its decision to reduce penalties for possession has immediate cross-border implications. If a person crosses the border into New South Wales, they will be subject to different penalties for the same behaviour. This creates a legal inconsistency that can have severe consequences. Furthermore, implementing drug reforms at the individual state or territorial level could be redundant, as individuals seeking to evade penalty may be encouraged to simply move states, undermining the intent of the reform, which, let's not forget, is to ensure drug users receive help and support. To further emphasise this, a study was conducted in France and Denmark to see if similarly reduced penalties for the personal use of drugs were effective. The state leaders of the French state Brittany and the Danish province Bornholm both reported that distribution of illegal drugs increased by 38% after implementing similarly amended legislation in the absence of federal legislation. There is a risk that the ACT's reduced penalties could attract drug traffickers looking to exploit jurisdictions with the lightest penalties. A federal law would help counteract this possibility by maintaining uniform penalties and a comprehensive framework targeted at boosting prevention, treatment and rehabilitation on a national level. Therefore, this is a better idea than the ACT's current law implementation. In conclusion, we resolutely believe that the ACT's decision to reduce penalties for the personal use of drugs is a bad idea. There is a clear lack of evidence to support that this reform will reduce stigma or recreational drug use, and federal legislation will be much more effective in resolving an issue as complex as drug use. Thank you.
I call upon the second affirmative speaker, Priya Vemprala.
Good afternoon, Madam Chairman, ladies and gentlemen. The topic for today's debate is that the ACT's decision to reduce penalties for the personal use of drugs is a good idea. We, the Affirmative team, undoubtedly believe this statement to be true. I will now discuss the flaws found within the opposition's argument. The first speaker of the negative team has attempted to argue that the decision was not very well thought and was not thoroughly discussed. According to the Select Committee for Drugs of Dependence Amendment Bill, the ACT Assembly introduced the bill, leading to the formation of the Select Committee on the bill. Concurrently, the Standing Committee for Health and Community Wellbeing initiated an inquiry into drug harm reduction programs. The Select Committee expanded its scope to include drug harm reduction programs, receiving 800+ submissions and hosting 5 days of public hearings in July 2021 with various witnesses. Ladies and gentlemen, this was a very thoroughly discussed and well thought out decision. The first speaker of the affirmative negative team has also attempted to argue that the decision may conflict with the federal laws that prohibit the possession and use of drugs, and that it may be more effective to have a federal law. According to an article published by Australian Police, the federal drug laws mainly target the import and export of prohibited drugs, while the state and territory laws deal with the manufacture, possession, distribution, and use of drugs. According to the Department of Health and Aged Care, the decision to reduce penalties for personal use of drugs does not affect federal laws, but rather aligns with the national drug strategy that aims to prevent and minimize drug-related harm among individuals and communities. Moving on. Our first speaker has spoken of the recognition that the use of drugs is a health issue and showed how the removal of criminal penalties will relieve cost burdens on the justice system and the government. As second speaker, I will discuss 2 points. My first point is that reducing penalties for the personal use of drugs can lead to better family and social relationships and improved mental health. According to the National Institute of Health, people with substance use disorders are subject to strong social stigma, which consistently ranks drug use disorders and its associated criminalizations as one of the most stigmatized conditions. The social stigmas and preconceptions that drug users are dangerous and irresponsible have a significant impact, causing users to devalue themselves and internalize a sense of isolation, shame, and produce feelings of guilt, hopelessness, anxiety, and depression. This ultimately limits opportunities to manage dependency and seek rehabilitation. According to PubMed Centre, this results in avoidance of social supports and treatment centres, hindering their chances of recovery. Reducing penalties allows for a redirection of a user's preoccupation to health interventions and rehabilitation services. According to the Alcohol and Drug Foundation, the introduction of the reduced penalties will result in combating these emotions of self-guilt and promote individual health. Those who are found with small quantities of drugs are not charged. Rather, they are subject to a fine or community service with a referral to drug treatment centres. This is a vast improvement on imprisonment and criminal records as provided for in the Amendment Act. More people will be encouraged to seek help and rehabilitation, leading to improved mental health, while also promoting better relationships with family and friends. This also improves social interactions and access to job opportunities. This leads to my second point, that the reduction of the drug penalties will lead to better integration into the workforce and more employment opportunities. According to a study by the United Nations Office of Drugs and Crime, it was found that people aged 18 to 25 who were involved with the personal use of drugs found it more challenging than those who didn't use drugs to enter the workforce. Further research uncovered that unemployment for this particular age group was caused due to criminal records for the personal possession of drugs. This United Nations study shows that the inability to cope with such shame and rejection often leads to an increased consumption of drugs, creating an endless, vicious cycle. With the reduction of the penalties, such harmful cycles can be avoided and reduced. The Alcohol and Drug Foundation discusses how reducing penalties removes the negative consequences for minor drug use and possession. Not only does this increase employment opportunity, but it also assists in decreasing individual consumption of drugs. I ask you, ladies and gentlemen, is it not a good idea that this act will allow drug users better access to employment, improved mental health, and social integration? So, Madam Chairman, ladies and gentlemen, to conclude, we, the Affirmative team, have demonstrated that the ACT's decision to reduce penalties for the personal use of drugs is a good idea. Thank you.
I call upon the second negative speaker, Nithika Vivemanandan.
Good afternoon, Madam Chairman, ladies and gentlemen. As you're aware, the topic for our debate is that the ACT's decision to reduce penalties for the personal usage of drugs is a good idea. Our first speaker has already spoken to you about how there is no evidence to support that reducing penalties on the ACT will motivate drug users there to refrain from using drugs for personal recreation, and that federal legalisation is a better idea to reduce drug crime. Today, as second speaker, I will be rebutting I'll be debating that the ACT's decision to reduce penalties for the personal usage of drugs is a bad idea because this method has been unsuccessful in other places and it is more important to take preventative measures rather than reducing penalties. Our third speaker will rebut and sum up our team case. Before I present my arguments in detail, I will rebut the arguments of the speakers from the affirmative team. The first speaker of the affirmative team said that reducing penalties can lead to reduced expenses related to arrests, prosecutions, and incarcerations for drug-related offences. While potential cost savings may occur, it is important to recognise that when these penalties are reduced, there is still a risk that it could lead to an increase in the living costs, such as a higher demand for healthcare, including emergency room visits for overdose and addiction treatments. And now to my first point, that the ACT's decision to reduce penalties for the personal usage of drugs is a bad idea, and instead we should look to places that have adopted more successful approaches to legislating drug policies, because this method has already proven to be ineffective. One of the primary concerns when reducing penalties for drug offences is the potential increase in overall drug use. For example, Portugal is often raised as a country that has been successful in drug decriminalisation. However, it is essential to note that this did not go quite to plan, underpinning the perspective that a one-size-fits-all reform cannot be implemented across diverse cultures to resolve complex problems such as drug use. A study published in the International Journal of Drug Policy found that drug use among young people in Portugal increased after the reform. This highlights the idea that reduced penalties can lead to the perception that drug use is less risky and does not have robust consequences. Like Portugal, there are many other instances where this is not working and where it has proven to be ineffective. The ACT government has said that the purpose of the reform is to channel people away from the criminal justice system into health services, and they are morally obliged to use the best proven methods possible to do so. According to the National Library of Medicine, only 21% of drug users in 2021 and 15% in 2022 who were excused jail time attended one rehabilitation session. This brings to attention how ineffectual the reform would be for the ACT. Where two cultures exist, it would be much better to design anti-drug support within countries using federal law reform. Switzerland's approach to drug policy focuses on harm reduction and providing support to those with drug issues. They've implemented a heroin-assisted treatment program, which provides medical-grade heroin to individuals with severe addiction. This program proved to work well as it reduced crime stats, improved the health of participants, and overall decreased issues associated with drugs. It effectively bridged the gap between addiction and support services. And now to my second point, that studies show that the best idea to reduce drug use and get people into support services is through prevention and diversion. The National Institute of Drug Abuse states that prevention is the best strategy to reduce drug use statistics. The National Drug Use Surveys indicate some children are using drugs by the ages of 12 or 13. Education is a powerful tool in combating drug use, and numerous studies have proven this. For instance, a meta-analysis published in the journal Addiction found that school-based drug education programs significantly reduced drug use among youth. Prevention, as the saying goes, is better than the cure. A report published in the Journal of Studies on Alcohol and Drugs found that prevention programs targeting at-risk populations were effective in reducing drug initiation rates. Prevention techniques can include school-based initiatives, community outreach efforts, and public awareness campaigns. Let us focus on what the studies consistently show works: education and prevention. As my first speaker stated, this reform has a missing step. Prevention of drug use and diversion will give drug users the opportunity to set them on better paths and get them off drugs. And so, ladies and gentlemen, in conclusion, we the negative team resolutely believe that the ACT's decision to reduce penalties for the personal usage of drugs is a bad idea, and they should look to places that have adopted more successful reforms, and it is more important to take preventative measures rather than reducing penalties. Thank you.
I call upon the third affirmative speaker, Abhinav Murugappa.
Good afternoon, Madam Chairman, ladies and gentlemen. The topic for today's debate is that the ACT's decision to reduce penalties for the personal use of drugs is a good idea. We, the affirmative team, firmly believe this statement to be true. Now I'll be moving on to my rebuttals. The first speaker of the negative team has attempted to argue that decriminalisation will not affect drug use rates in the ACT. A multitude of evidence contradicts this. For example, Portugal's experience with decriminalisation, as documented by the European Monitoring Centre for Drugs and Drug Addiction in 2020, reveals a decrease in drug use among young people since the policy's implementation in 2001. This highlights that decriminalisation can, in fact, have a positive impact on drug use trends. Moreover, a study published in the British Journal of Psychiatry in 2019 examined the relationship between drug policy and drug-related mortality rates. It found that countries with more punitive drug policies tend to have higher drug-related deaths. This underscores the potential to harm reduction benefits of shifting from criminalisation to decriminalisation, as seen in the reduced drug-related fatalities in regions with more lenient approaches. The first speaker of the negative team has also attempted to argue that current laws may conflict with federal laws and that having a federal law would be more effective. According to an article published by the Australian Police, the federal drug laws mainly target the import and export of prohibited drugs, which are considered serious offences that threaten national security and public health. According to the ACT government, the state and territory laws deal with the manufacture, possession, distribution and use of drugs, which are considered less serious offences that affect individuals and communities. According to the Department of Health and Aged Care, the decision to reduce penalties for personal use of drugs does not affect the federal laws, but rather aligns with the national drug strategy that aims to prevent and minimize drug-related harms among individuals and communities through a balanced approach of demand reduction, supply reduction, and harm reduction. The second speaker of the negative team has attempted to argue that the decision sends a mixed message to the public and undermines the health and social harms of drug use. The decision is based on sound evidence and best practice. According to former Supreme Court Judge Richard Shefauch, who co-authored a paper calling for decriminalisation, the criminal justice system is not equipped to deal with the complex issues of drug addiction and rehabilitation. He argues that decriminalisation does not deter drug use, but rather increases the risk of overdose, infection, and mental health problems. By contrast, decriminalisation can reduce these harms and save lives. He cites countries like Portugal and Switzerland that have adopted similar reforms. Further, according to the Alcohol and Other Drugs Knowledge Centre, decriminalisation can also reduce social costs such as violence, crime, and trauma, all associated with drug use. The second speaker of the negative team has also attempted to argue that the decision does not address the underlying causes of drug addiction, such as mental health issues, trauma, poverty, and they have mentioned education and prevention as good strategies to combat drug addiction. Aspen Ridge Recovery Centre states that it can free up resources for more effective interventions, as the negative team mentions, that address the root causes of drug use, such as trauma, pain, and unmet needs. This approach has been proven to work in countries like Portugal and Switzerland, according to Psychology Today, which decriminalised all drugs in 2001 and saw significant improvements in public health and safety. Further, according to a study published by the Recovery Village, by reducing penalties, the ACT is breaking the cycle of addiction and harm and recognising that drug use is a health issue, not a criminal one. The ACT government states that this can encourage drug users to seek help and access harm reduction services without the fear of being prosecuted or discriminated against. Now to summarise our team case. Our first speaker showed that the extensive parliamentary inquiry through social and scientific consensus found that criminalising drug users does not deter drug use or address the root causes of dependency. She then showed that removing the penalty of a prison sentence reduces the cost burden of policing, court procedures, and imprisonment on government and justice agencies. Our second speaker showed that reducing penalties for the personal use of drugs can lead to better family and social relationships and improved mental health. She then went on to show that the removal of criminal penalties will lead to better employment opportunities and improved integration into family and social relationships. So to conclude, Madam Chairman, ladies and gentlemen, it is highly evident that the ACT's decision to reduce penalties for the personal use of drugs is demonstrably a very good idea. Thank you.
I call upon the third negative speaker, Cynthia Zhang.
Good afternoon. afternoon, Madam Chairman, ladies and gentlemen. The topic for our debate today is that the ACT's decision to reduce penalties for personal use of drugs is a good idea. Today, you have heard how reducing penalties is a horrible decision, as there is not enough proof that it can reduce drug-related stigma, and it is too simplistic of a solution to a complex issue. Before I conclude our debate on this topic, I will rebut the opposition's arguments. The first speaker of the Affirmative team has said that law enforcement officers will be able to channel drug users into health services they require and not the criminal justice system. In a radio interview on ABC Radio Canberra earlier this month, Deputy Police Commissioner Neil Gohan said that officers will now see people take a line of coke, where historically they may have intervened, but they're not going to now. How will the users be channeled into health services if they're not going to be challenged and picked up? Similarly, it should be acknowledged that the assumption that law enforcement agencies will seamlessly transition their focus from prosecuting personal drug use to addressing more severe crimes is a hasty generalisation fallacy. The second speaker of the Affirmative team has said lowering penalties can reduce stigma associated with drug use and addiction, making it easier for individuals to seek support. This may be true, but it should be acknowledged that stigma is deeply ingrained in society and can persist even when legal consequences are reduced. The second speaker also said that reducing penalties was in line with the national drug policy. This may be true, but the topic of tonight's debate is that the ACT's decision was good or not. The national drug policy is national. We are arguing whether the ACT's decision is good for the ACT, not that it matches with the national drug policy, and therefore a red herring and irrelevant. The Affirmative team has also said that stigma and discrimination often associated with drug use can be barriers to help seeking. This is true. However, as we have stated multiple times, there is no motivation for people using drugs to seek help, and there are no clear steps in the law to help them receive them. In a radio interview on ABC, the second speaker of the Affirmative team said that reducing penalties for drugs encourages struggling individuals to seek help. This may be true, but has negative consequences, as solely reducing penalties without an effective support system in place can cause individuals to be more likely to relapse or continue their drug use without adequate supervision or intervention. This can result in ongoing health risks, including overdose and the spread of diseases. Therefore, it is crucial to strike a balance between reducing penalties and providing comprehensive support and treatment services to address the complexities of drug addiction. The third speaker of the Affirmative team has said that replication of drug reforms work in other countries, such as Portugal and Switzerland, and it will work in the ACT. This is partly a faulty analogy fallacy, as it is not possible to compare a territory to a country. Portugal, similarly, this approach has been proven ineffective, as the European Monitoring Centre for Drugs and Drug Addiction reported that Portugal's drug use rates were higher than the European average for several substances, including cannabis and MDMA in 2019. Just because it worked once doesn't mean it can continually work. Our first speaker has already spoken to you about how the reduced penalties is a flawed approach and has a missing step. The reasoning behind the reduced penalties is missing a motivational factor in the ACT's approach and doesn't sufficiently encourage drug users to actively seek assistance. He also spoke about how a federal law should be seen as crucial for a comprehensive drug policy, including prevention, treatment, and rehabilitation. Our second speaker spoke about how reducing penalties has been an unsuccessful reform in other places, and that there are better approaches to drug issues. She also spoke about how prevention is the best strategy to reduce drug use statistics and is a more effective strategy than reducing penalties. And so, Madam Chairman, ladies and gentlemen, in conclusion, the ACT's decision to reduce drug penalties is a horrible idea. Not only is there insufficient evidence that will reduce stigma, but is also a solution too simple for this complex issue. Thank you.
I call upon a representative of the adjudication panel to come forward and award the debate.
Okay, hi everyone, and welcome to Grand Finals of Debating SA.
So first off, we would like to commend both of the teams here today for a really strong debate. We've had the privilege of getting to watch you debate through the season, and you really put up a good argument tonight from both sides. Tonight's decision was unanimous, and we awarded the debate to the affirmative team tonight. So thank you so much. I'll hand you back to our chairperson to close the debate.
I call upon a member of the runner-up team to give a vote of thanks.
We'd like to thank the opposition team because, wow! And we also like to thank the audience and obviously the adjudicators and the chairperson and timekeeper and our coach and everyone who came here today. Thank you.
Firstly, we'd like to thank the opposing team, which presented a really challenging and very well thought out debate. We'd also like to congratulate them for making it to the grand finals, which we all know is no easy feat. We'd also like to thank the adjudicators for taking that time to be here, listening to our speeches, and providing us with your educated decisions. We'd like to thank the audience for being here today and providing us with the support through your presence. And we finally wish to thank our debate coach, Ms. Farrell, for taking the time to thoroughly read our speeches, sitting with us through recess and lunch and lesson times, and providing us with lots of feedback. Thank you very much.
Ladies and gentlemen, thank you for your attendance. I now declare this debate closed.